Hi, my name is Jain, MD. I'm a interventional pain management specialist. I am the owner of Pinnacle Pain Management and Pinnacle Interventional Surgical Center. Today we're talking about a diagnostic procedure called a lumbar discogram. Lumbar discograms are done to determine if the pain is coming from the disc itself. So back pain can be a result of a facet joint pain, or it could be the result of the disc itself. The disc has nerves in the back of the disc that when they're disrupted, or when there's a tear in the outer layer of the disc, the annulus, those nerves can cause back pain when you're doing things like standing, sitting, anything that creates pressure on the back. So we access the disc itself with a needle. Once the needle is in place in the disc, we pressurize the disc to recreate the conditions that you have when you're sitting or standing. When you're laying, you have the lowest pressure, just like a tire, in the disc. So the disc is not usually pressurized to the extent that it is when you're sitting or standing. People don't have pain as much when they're laying as they do when they're sitting or standing. So we're recreating that pressure situation in the disc up to 100 psi to see if we can recreate the pain that they typically have in their back. Along with pressurizing the disc, we inject a dye into the disc itself, which will show the anatomy of the disc and whether there's a tear in the back of the disc that needs to be repaired. After the injection is done with the dye and we determine whether the disc is painful or not based on what the patient reports back to us in the OR, we send the patient for a CAT scan, which gives us a scan and an exact visualization of the disc that we put dye into. And that'll help corroborate whether that disc has a tear, B, it reproduces the pain that they normally have, and that they may be a surgical candidate as a result of this. This excludes pain that may not be coming from the disc and avoids having surgery on a disc that is not causing the pain. This is a diagnostic procedure that we do that provokes pain. That's the goal of the procedure, or recreate the normal pain that the patient is having. So the patient does have increased pain for 24 to 48 hours after the procedure because we've provoked the pain during the procedure itself. The pain is mild to moderate and usually can be treated with anti-inflammatories and muscle relaxants, but sometimes it can be more than that, and we treat it appropriately based on the amount of pain the patient's having. But the pain does go away. If you have any questions related to what happens prior to the procedure, during the procedure, or after the procedure, please feel free to ask.